question from a patient. One of our international patients, over 40 years old, and he has bow leg and actually flexion deformity right now, and he's asking what kind of treatment that he needs. Can you tell us about this in this case?
Okay, to do this, as a first step, we should analyze the deformity. I mean, where the deformity of the patient is. The bow legs or knock knees, the flexion deformity, back knee, general recurvatum, all of these deformities are around the knee joint. First of all, we should find where those deformity is. They may located in distal femur or proximal tibia or both. So we should analyze that. Today, let's just suppose the deformity is located in proximal tibia, both of the deformities. The most popular osteotomy surgical technique is high tibial osteotomy. Many people knows this technique, and most of joint surgeons do this kind of osteotomy to correct the varus. High tibial osteotomy is like this. Cut the bone along this direction and open this gap. Here's the hinge. So when you open this gap, the bone change like this. This is how high tibial osteotomy correct the tibia. As you see, this is quite simple surgery, but the limitation of this technique is only able to correct this plane, the varus to valgus. High tibial osteotomy only correct bow legs of the proximal tibia. It does not able to correct flexion deformity or rotational deformity. Let me introduce another osteotomy. The direction of the osteotomy is like this. This is a transverse osteotomy. So if we do this osteotomy, we can move the bone to any direction simultaneously. Varus to valgus and flexion to extension and rotation. So even I can correct simultaneously, three-dimensional correction is possible with this kind of osteotomy. But traditionally, this transverse osteotomy only can be done by external fixator. I want to introduce my own technique, STTO, subtuberosity tibial osteotomy. The direction of osteotomy is transverse. The tuberosity means this is tibial tuberosity. Patella tendon is attached here. Osteotomy is done distal, just distal to the tibial tuberosity, and the fixation is done by internal fixation. So there is no external fixation. This is a very difficult point because when the transverse osteotomy is done during the surgery, the surgeon has difficulty to control this segment if he do not use external fixator. STTO is to make a transverse osteotomy using internal fixation. So this technique can make any direction of deformity can be corrected. So make you guys understand this name of operation, special technique for tibial osteotomy. This is easy to remember. So using this, my technique, STTO, I can correct any direction, varus to valgus, or valgus to varus, or flexion deformity, or extension deformity, or rotational deformity. Any kinds of deformity of the proximal tibia can be corrected without any external fixator. So maybe you guys call this technique as STTO. STTO is for correction of any kind of deformities of proximal tibia without external fixator, and even with minimal invasive surgery. I hope you guys remember this surgery, and if you have any problems, any deformities of proximal tibia, you can contact us.